What is a lisp? A lisp usually refers to a person's difficulty producing the s and z sounds correctly because of incorrect tongue placement. Lisp can be frontal or lateral based on the placement of the tongue. A frontal lisp is when the tongue is sticking out between the front teeth like this. So soup will sound like toop, toop. And a lateral lisp happens when the sides of the tongue may not be high enough or tense enough in the mouth, and so air escapes through the sides of the tongue like this. So here soup will sound like shoop, shoop. Both of these articulation errors result in sound distortions. Now let's look at few simple strategies to help a child with the lisp produce s and z sounds correctly. For frontal lisp, a very simple yet effective strategy is to use a mirror. This will help to provide a visual feedback to the child. This way, the child will be able to see the tongue is sticking out of the mouth while saying these sounds. Most of the times, children are not aware that the tongue is out while saying these sounds. So a mirror helps them to see if the tongue is sticking out or if it's behind the teeth. And in most times, they can easily bring it back to behind the teeth and produce the sounds correctly as they are looking at the mirror. Another easy method is to tell the child to bite, smile and blow like this. Bite, smile and then blow. This can help the child to learn to keep the tongue behind the teeth. Now for lateral lisp, have the child hold a feather or a strip of paper in front of the mouth and try to blow air through the front of the mouth. Or use a straw between the teeth and direct air through it. You may also have the child pretend to pull a piece of string out of their mouth while producing s. This will help the child to understand that air has to go through the front and not from the sides. Now, in children, a frontal lisp is often a developmental distortion. This means that it may improve on its own as a child develops new sounds. On the other hand, a lateral lisp is not a developmental distortion. Also remember that these two sounds, s and z, are mastered only by 6 to 8 years of age. So don't worry if your child hasn't mastered these sounds perfectly yet. But if you think you have a concern, please do see a speech therapist so that you can start working on it earlier than later. Also, if you're an adult working on these sounds, don't be discouraged. It can still be beneficial to start working on these sounds. Remember, it is possible to retrain your tongue muscles and learn the correct production and make clear and better speech. Thank you.